This 37-year-old female patient lost her upper right lateral incisor. This is the single tooth gap with and without the temporary restoration. The incisal view shows a shallow horizontal bone defect in the oral vestibular direction. 22 weeks after tooth loss, the extraction socket has healed well. The mesial distal dimension of the gap allows a CAMLOG screw line implant of 3.3 millimeters diameter to be placed. The surgery is performed under local anesthesia using ultrasyn DS Forte. The incision line is located slightly palatal of the midline of the alveolar crest and is extended in mesial and distal directions. Vertical relief incisions in the vestibulum give an ideal view of the site. The flap is carefully mobilized using fine elevator instruments. The most important aspect of this procedure is the gentle handling of the soft tissues. The overview of the site is ideal. Scalloping of the alveolar crest in the area of the gap is harmonious. The mobility of the flap is checked to ensure that the soft tissue can be readapted after the insertion of the implant and the simultaneous augmentation. A surgical stent is needed to place the implant into the gap with maximal precision. An important aspect is the precise mesial distal position of the implant with a slight distal alignment for a perfect soft tissue margin. A platform is created with the round drill to allow the following pilot drill a perfect entrance point. Now the surgical template is positioned. The initial drilling procedure with the cylindrical pilot drill of 2 millimeters diameter can be done with high precision. Using a periodontal probe, the alignment and the axis of the preparation are checked again. The next step continues the pilot preparation with drilling at 800 RPM to the planned sink depth. The pre-drill follows the pilot preparation with a reduced speed of 600 RPM. The conical preparation is extended to 13 millimeters. The form drill of 3.3 millimeters is the final instrument for the defined preparation of the implant bed. The drill is used at the speed of 500 RPM. Screw-line implants come with a promote surface for the best bone-to-implant contact. A CAMLOG screw-line implant with a promote surface of 3.3 millimeters diameter and 13 millimeters length is inserted. The conical screw design produces optimal primary stability. In this case, it's not necessary to tap the thread. The implant is inserted with the contra-angle adapter at a speed of 15 RPM. When placing CAMLOG implants, the most important point is the direction of the cams in the implant. On the insertion instrument, visible marks indicate the position of the cams. For correct alignment of the implant, one of the cams has to be placed in the labial direction. The mirror view shows the optimal position of the implant in mesiodistal, orofacial, and vertical dimensions. After the final check of the position, the insertion post can easily be removed by a screwdriver. The cams are perfectly placed, one in the labial direction. A second mirror view demonstrates the excellent vertical position of the implant shoulder in relation to the cemento-enamel junction of the neighboring teeth. Ideally, the implant shoulder is 2 to 3 millimeters apical of the CEJ. Instead of a cover screw, a gingival former 2 millimeters high is used. This procedure helps create a vertical extension of the soft tissue during the healing period. Excess soft tissue is important for the aesthetic result, especially the formation of a perfect papilla. For tension-free adaptation of the soft tissue for primary wound closure, the periosteum is released. This release improves the mobility of the mucoperiosteal flap. The wound margins are closed using a 5-0 monocryl suture from Ethicon. The interproximal papillae are well adapted with interrupted single knot sutures and stabilized with vertical mattress sutures. The relief incisions are also closed with interrupted single knot sutures.